is Crystal. I'll be your medical assistant today. Can I just verify your name and date of birth?
Dawn Ross, 4/13/65.
Okay. The doctor has ordered a collection of a stool sample to detect for hidden blood. So with that, have you had any experience having to give a stool sample?
No.
No? Okay. So for the sample here, we have this little handout. You'll get to take this home with you, so you know everything. If you have any questions, though, you could always call our office, or if you want to speak to a physician, or otherwise I can write down the questions that you have and give it to the physician. But with this, one of the things, we do not want to collect the specimen if it's during that time of the month, menstruating, or if you're happen to be suffering from bleeding hemorrhoids or open cuts in your hands. You're gonna get this little packet here. This is going to collect your samples. You're going to get this little applicator here. And then we're also going to give you some tissue paper as well to bring home with you. We're going to require 3 samples of these. You'll have to take for 3 days. But to prepare for that, 2 days prior for giving samples, we're going to have you be on sort of a diet here. There's some foods that you can eat and cannot eat. So it's going to be a red meat-free, high-reduced diet. For meats, only small amounts of cooked chicken, turkey, and tuna are allowed. Vegetables, fruits, cereal, and other high-fiber foods, such as peanuts and popcorn. For foods that you want to avoid, though, is red or rare meat. Also, horseradish, cantaloupe, raw, turnips, broccoli, cauliflower, red radishes, and parsnip. Also, for medications, do not ingest any high doses of aspirin or other anti-inflammatory drugs for 7 days prior to and during testing. Or vitamin preparations which contain vitamin C in excess of 250 milligrams per day for 2 days prior to and during the testing. However, you can speak to the doctor too before discontinuing any prescribed medication. So when you're collecting the specimens here, it is very important that the stool sample is going to be applied into a very thin smear on here with the applicator. So you'll want to get like saran wrap, a piece of saran wrap, put it in between the toilet seat and the toilet, and then you'll want to place the tissue paper over the saran wrap. And then you're going to want to go to the bathroom and have it catch in that tissue paper. And then to take the sample, you're going to want to take one side of the applicator here, and then you're going to smear it, thin smear, here on side A for one portion of the stool sample. And then you're going to want to use the other side and do a light smear on B. Now you want to take the sample from 2 different parts of your stool sample. The instructions, you'll want to remove all cleaners or deodorizers from your toilet bowl and tank. Flush the toilet twice to remove the chemicals that may be present. And then we're going to do the sample collection. So as I instructed, use the applicator to do the small little thin smear on each of the windows here. And then when you're done, you're going to let it dry though. And then you're going to close it up. And then you're going to put it in one of the envelopes we're going to give you. And you're going to do that 3 days. 3 days worth of the sample. And then instructions is going to be given to you. After you've collected the 3 samples, you're going to place it in the mailing envelope that we'll provide with you. And then you're going to mail it off to our lab. And then they'll do the test, and then we'll get the test back, and we'll either call or send you a notification in the mail. And then we'll also want to do a follow-up appointment as well after we get the results back. So if you can maybe read back to me so that I know your understanding of what to do. So what I forgot to mention is we're going to have you label the card though with your name, age, street address, phone number, and data collection, and your physician. Just make sure that's all filled out. And then also a good thing is too, to protect the specimen, you're going to want to not keep it around moist areas or get it wet. And then you're not wanting to expose it to light. That will ruin the sample, and then we'll have to try to get more samples for you. Is there any questions you might have at this time, or?
I do.
Okay.
If it's for 3 days and there's only 2 spots, where do I put the 3rd day?
So you're going to get 3 different cards here.
Oh, okay.
So one card is for one sample.
Okay.
You're going to do a light smear from 2 different sides of your stool sample from each area. And then you're going to do one smear here, do another portion of the sample, and then you're going to do another light smear there. And then you're going to let it dry, and then close it up and put it in the envelope that we provide you. Anything else that may be confusing you, or?
No.
No?
That's
Okay.
the only question I had.
Okay. And then the doctor will want to see you again before you leave, and just make sure everything. If you have any other questions, you can ask them at that time as well. But yeah, I will go get the doctor and let them know that we went over everything, and then they'll come in just a few minutes.
Okay.
All right? You're welcome.